Welcome to Your Healthy Kitchen from YRMC.
Welcome to YRMC's Your Healthy Kitchen. I'm your host, Rita Rubin, and I'm happy to welcome a special guest to our kitchen today to talk about an important screening that saves lives. Jennifer Harvey is the lung cancer screening and care nurse navigator at YRMC, where she guides patients through specialized testing designed to catch lung cancer at its earliest stages. We'll talk about some of the food challenges people face when they quit smoking, and we'll make a delicious, nourishing meal filled with ingredients that help your body detox from nicotine. Welcome, Jen.
Hi, Rita. Thank you so much for having me. It's a joy to be here.
It's a pleasure having you, yes. So tell us a little bit about the lung cancer screening and care program, and also what your job is like as a nurse navigator.
Sure.
Yeah.
So in the fall of 2017, YRMC launched to our community this lung cancer screening and care program, which utilizes a CT scan with less radiation, so it's called a low-dose CT, done annually, kind of like our mammograms, to catch lung cancer early in people who are at high risk. So my job as a nurse navigator, I get to do a lot of different things, but a lot of what I do day to day is talk to patients, and that can involve education about lung cancer screening and what to do when we actually find something on those exams. Smoking cessation is a big topic. And then I also get to work closely with the providers in town to help them identify people who could benefit from this scan, because it's not just smokers, it's ex-smokers too, and guide through what can be kind of a nuanced process in doing lung cancer screening and beyond.
So that must be really important for the patients to make them feel comfortable and understand more about what they're there for.
Absolutely.
As well as, like you said, educating the physicians so they know that you're there.
Absolutely.
Yeah.
People who do lung cancer screening are more likely to quit smoking if they are smokers. And I find that I've been gifted with having having time to sit with them. And so I get a lot of joy out of getting to know the patient, which gets their hopeful buy-in to come back and continue annual lung cancer screening. Because that's where we stand to see the benefit the most year after year.
Yeah, well, who benefits from getting lung screening?
That's a great question. So there are some national criteria, and bottom line is this is what insurance covers. They cover age 55 through 77, up to age 80 if they have a private insurance, and either a current smoker or quit within 15 years. And significant smoking. So what that looks like is something called 30 pack years or more. For example, if you smoked a pack a day for 30 years, then you would be a 30 pack year smoker. In addition, you want to have no current symptoms of lung cancer. And you want to be healthy enough and willing to undergo treatment if we were able to find something on the scan.
Okay, so right now for insurance purposes, like you said, current or ex-smokers, but if somebody had something that they were concerned with, they had been exposed to something in the past, how would they go about getting a screening or ask about it?
Right. So you do need a doctor's order, and it is true that people who fall out of that criteria may still be considered at risk, or they may just want to know for themselves because of exposures to secondhand smoke, to asbestos, radon, coal, for example, or maybe they were first responders and have worked with smoke in their jobs. And that really is a conversation between them and their provider, but ultimately they can pay out of pocket for the exam. This year it's about $149, and we definitely have people that opt in for that.
Great. That's great that that's available for them too. Well, you know, when I see folks that have quit smoking, I often hear that they've gained weight.
Yes.
And that, especially in that first year. And do people, you mentioned working with people about quitting smoking. Did they ever talk to you about their concerns about weight?
Absolutely. I think that's a very common concern.
Yeah.
I do just want to say, though, it's important to state that quitting smoking is the most important thing you can do for your health, far and beyond what weight gain you might get. That being said, what I see in national statistics is about 80% of people do gain some weight, averaging about 7 to 13 pounds. That's a real concern.
Sure.
It's enough to make your pants feel tight.
Yes, uncomfortable.
So definitely we'd be looking for ways and advice that you might have to help mitigate that weight gain when you quit.
Sure. Yeah, and like you said, definitely the statistics say that people will gain weight, and sometimes a little, sometimes a lot. But overall, you know, the less people substitute food for cigarettes, obviously the less weight they'll gain.
Sure.
So, you know, cigarette smoking, like a lot of habits that we accumulate, it's something that helps us cope with the stuff that happens in life.
Yes.
So I find that just like when people are craving food or anything, sort of getting out of your head and checking in with your body a little bit can be really helpful. Give it a pause before you go and grab that snack or that cigarette, and ask yourself some questions. So one of the things first I encourage folks to ask is, am I thirsty? You know, how much water did I drink today? Because if you're not hydrated, one of the things that can happen even without feeling thirsty is you can be dehydrated.
Sure.
Right?
Especially in Arizona.
Yeah, especially here. We're losing water all the time, every time we breathe. And if we're dehydrated, you can get really fatigued, and sometimes that kicks in the message to go get something to eat.
That makes sense.
Yeah. So try to make sure you have enough water. Hopefully, probably a couple quarts a day.
Yeah, that's a considerable amount.
Yeah, 8 ounce glasses, kind of that old recommendation. So check in, make sure you're well hydrated. Another thing that's helpful is just seeing what's coming up for you, because you know, food cravings can very much be associated with stress.
Sure.
Right, and anxiety, tension, and you might check in with what's coming up with your feelings, or even in your body where you know, are you having any experiences? Is there a place in your body that feels really tight or stressful? Me, it's always my back, my shoulders always kind of climb up towards my earlobes. And then ask yourself, how can I take care of myself in a healthy way?
Sure. Do you have any suggestions for people who are looking for healthy snacks in particular?
Sure, yes. So with snacking, I think that leads into the next question really well to ask yourself is, am I hungry?
I see.
Right? And
which you might be.
Which you might be.
Yeah.
And if you are hungry, then make some food. So fix yourself a plate of food or a bowl of food, and sit down to enjoy it without distractions like TV or your phone or your computer. I think it's best try not to grab food and on the run, because it's really neat that your brain actually scans what you're eating. And if you're eating on the run, or you're eating really quickly or in a distracted way, your brain can't really acknowledge that you've eaten anything.
Yeah.
And so you might be looking for food again in another 10 minutes. So actually just being present. And then another thing we're finding out too is if we eat when we're in a relaxed state, we actually burn more calories.
Wow.
That your metabolism actually works better when you're relaxed.
Okay.
So those are some neat tips to share with folks. And then, snacking, right? So if you are hungry, try to think of snacks as a little meal. I think it's helpful not to go for something that's really sweet, though that can be things that you definitely crave when you're quitting smoking.
But there's other sweet things like an apple with peanut butter, or something like that.
Yeah, have something that's naturally sweet. That'd be just fine. And then again, think of it as a little meal. Have something with some vegetables in it, or some protein and some healthy fat and some fiber, because those snacks are going to be more filling and satisfying.
Yes.
So simple ideas could be some cottage cheese, maybe with some fruit, and throw in some chopped walnuts, or my happy standard peanut butter and celery, throw some raisins on top, or maybe even just make yourself a small salad with some greens and avocado and a little protein, anything that's actually going to nourish your body.
I don't know if you know this, that peanut butter is a nurse's secret weapon. It is.
And how is that?
Well, you always have peanut butter on hand that you can add to all those things that you mentioned on a busy work day.
Yeah, sure.
So that you can get that sustaining nutrition to get you through your workday.
Well, I think it's the dietitian's secret weapon too then.
Yeah.
I always have a jar of peanut butter in my desk.
Exactly.
So,
exactly.
yeah, definitely.
Now, you know, I have a lot of people, they're coming in, we're talking about quitting smoking, sure.
Yeah.
But they also talk about a lot of different fad diets. And
yeah.
I wanted to see what you think about that, because that can involve cutting out carbs completely or even skipping meals. And maybe it works temporarily, but is that really good in the long term?
Well, you know, everybody's different, and some people do well on certain diets, for sure. Though any of the research you look at, 98 to 99% of people who start a diet don't continue it. And so very often you'll get this initial weight loss and then weight gain back.
Yeah,
and I
the
think
yo-yo effect.
Yeah, and I think that when you're already restricting yourself and trying to quit smoking, it's not a great time to go on a strict diet.
Gotcha. It's too much at once.
It is. Yeah. So, so I think, you know, really just focusing on healthy meals, eating lots of vegetables, especially a lot of greens, using fresh herbs and spices to flavor your meals. All of those things contain the phytochemicals and nutrients that help your body detox from cigarettes. And then you add some whole grains and protein, and that'll give you a sense of fullness and satisfaction.
And quick energy, from those complex carbohydrates.
Sure, yeah, lasting energy. And so yeah, one of my favorite meals, I make Buddha bowls.
Buddha bowls.
Yep, and we were talking earlier, well, how is it to become named a Buddha bowl? And I think your answer
you
was...
rub your belly like a Buddha. It makes your belly feel happy, and your body too, right?
Fills you up,
yeah.
Right, and it's something that makes you feel nourished. And it's basically a bowl, a meal in a bowl. So it's got some healthy carbs, some protein, lots of greens and vegetables, and lots of flavor. So
this smells very flavorful
smell
already.
great?
I see onions and garlic. And is it fennel that you've put in
that
there?
is cumin, whole cumin.
Ah, okay.
Yeah, so this is a... you know, my version of a Spanish rice. So there's lots of recipes out there for Spanish rice, and most of them use white rice, but this I'm using some brown rice, and which is going to be a little more filling, a little more high in fiber.
Fiber, yes.
So I've just I've cut up a couple different kinds of chilies. There's a poblano and an Anaheim, and some garlic and onions, and I just threw in some whole cumin.
Wonderful, lots of flavor.
Lots of flavor. I think I'll throw in a little bit of dried Mexican oregano. That's pretty yummy. And saute that stuff down until it's nice and tender and soft, and then just throw in some rice.
And you can find all of this stuff at a regular grocery store.
Absolutely.
Right?
Yeah. Oh yeah, absolutely.
All standards.
Right. No, no special stuff here. This is, you can also cook all these ingredients in a pot with the rice, but I find that if you saute it first and add rice that's already cooked, it pulls the flavor up a little bit.
Yeah, I hear you.
Yeah, so I'm going to also throw in some tomatoes, some diced tomatoes.
All the colors.
Yeah, right, and all those colors are so important nutritionally. So we'll just let that cook up.
Okay.
Yeah, well,
looking great.
So you are obviously so passionate about what you do. What drew you to your job as nurse navigator with this lung screening program?
I love that question because it's not where I expected to be at all.
No,
I never wanted to be a nurse growing up.
Really?
No, maybe a detective.
Detective.
No,
to go into forensic.
Right. When I went into college, I was studying literature and music.
And you are in a band.
Yes,
an
I'm
all
in a band called the Girly Girls. And so I get to do music on the side, and I write music on the side. But ultimately, when I was in college, a tragic thing happened. My brother passed of a bone cancer.
Oh gosh, I'm sorry.
Yeah. And so it really shifted my trajectory on what I wanted to do with my life. I thought, oh, well, I want to be a nurse and take care of cancer patients. But ultimately, when I graduated from nursing school, it was too close to home.
Yeah.
And I became a cardiac nurse for a long time. I worked in the YRMC cath lab recovery for 12 years, for example, and I loved it. But there was this little voice calling me back to work with oncology. And when this opportunity came, this new thing that I'd never heard of about catching lung cancer early, it was such a different storyline than what I saw in the cath lab. We play sports in the cath lab for chemotherapy, so I knew about lung cancer stories. I knew that by the time they came to see us that they were often late stage and hard to treat. And here we have this way of catching it early so we can actually provide a cure. So I was really on board and felt uniquely called to the job also. I did smoke until I was 29. And so when I'm counseling people with smoking cessation, I feel like I've been in their shoes at least for a part of the time. And my grandfather also passed from lung cancer. So all these things together made this role call out my name.
Yeah. I mean, it sounds like you're perfect for what you're doing.
I really enjoy it. I really enjoy talking to people like you, patients and providers, and hopefully getting to make a difference in our community.
Yeah. Well, you've been with the program for a couple of years? And
since 2017.
And how many people have come through so far?
We have had 770, give or take, participants in lung cancer screening. Many who've come back for their annuals, just like we should with their mammograms. So over 1,000 scans have been done. And we have found 15 cases of lung cancer so far.
Wow.
So it really is working. It really is effective.
And are those people who went on to get treated and...
Yeah, so many of those
you know.
were early stage lung cancers, and the best outcomes are when they get to have surgery with Dr. Tibby or Dr. Torres. Now we have Dr. Adaran here on board.
Sure.
And then they get to they don't have to do chemo, they don't have to do radiation, caught it early, and they're good.
Such a great service. Well, what are your hopes for the future with this program?
My hope is continued growth and continued buy-in from our providers to see this as a value, like mammograms have become, like colonoscopies have become for colon screening, that it becomes the standard of care for people that are at high risk for lung cancer. And when we do that, we get more people that have their lives saved from lung cancer.
Sure. Yeah. Oh, well, what great work that you do. Thank you so much.
It is a joy for me, for sure.
With that with us. Well, shall we put together our bowl?
Yes, I'd love to.
Okay. So you were over there chopping earlier.
I sure was.
Yes.
I got a rainbow, kind of a green and red rainbow
it's
here.
It's beautiful. Yeah. So
you've got another green and yellow over here.
It's all about color. Yeah. So yeah, usually I just fill my bowl with stuff. So we've got so some of the Spanish rice.
Yum.
And
all those extra flavors in there.
Yep, doesn't it smell great?
Yeah, should I go ahead?
Sure, help yourself. These are just some black beans that I cooked last night in a slow cooker with some of my favorite smoked chilies from Whipstone Farm at the Prescott Farmers Market.
Nice.
Does that smell great?
Oh, so rich.
So I put that in a crock pot with some bay leaves and the smoked chilies, a little bit of oregano, some garlic.
These are the bay leaves right there?
These are the bay leaves. These are actually even from the farmer's market as well.
They're big and beautiful.
Aren't they beautiful? Yeah. And then I just pile on the stuff, lots of greens and veggies, and make it taste delicious. And then we also have a dressing that is simply some lime juice, a clove of garlic, about twice as much olive oil as lime juice. This guy's kind of slow. And just a vinaigrette, a basic vinaigrette.
So it's going to be low in sugar.
Yeah, actually there's no sugar.
And a healthy fat from the olive oil.
Yep, and just a little bit of a brightness from the lime and a little bit of a little spunk from the garlic.
Yes, and then the lime will pair nicely with the Southwest flavoring.
Yeah, it's perfect. And just a little bit of salt, and then I throw in some pureed chipotles. Just chipotle and adobo sauce that I just puree in a blender. I usually keep a jar of it in my refrigerator.
Very flavorful. How spicy?
Just to add flavor. Yeah, and it can be
Little kick?
a little kick.
Yeah.
Not crazy spicy. I'm not great with a lot of spice myself, so I don't make it really hot. But you could add more if you want to. So
Yeah.
And yeah, we'll just top our Buddha bowls with this lovely dressing.
Nice.
And have a nice meal. So how can people find out more about the program?
There's a couple of ways that they can. You know, it's always good to talk to your provider, because we've talked about the criteria and what insurance covers, but there's more to it. Is it right for you? So speaking with your provider, your doctor, nurse practitioner, whoever takes care of you, is a great starting point. You do need a doctor's order to have a lung cancer screening anyway. And then you can also call me, because I'd love to walk people through, is this a benefit to them? And they can reach me at 771-5454 as the nurse. It's kind of a long title, the Nurse Navigator for the Lung Cancer and Screening Care Program at YRMC. But I'm there Monday through Friday and love to answer people's questions.
That's great. Yeah, I did have to practice saying that a few times. Thank you again. This has been fun.
Joy. Yes.
So remember, you can access all of our videos and delicious recipes at yrmchealthconnect.org. Simply scroll down the screen and click on YRMC's Your Healthy Kitchen. And you can also follow me on Facebook at YRMC's Your Healthy Kitchen, where I regularly post photos and mini videos about the meals I make at home, with interesting links to recipes and other health-related sites that I enjoy, plus insider tips and updates on food and gardening events in the community. And until next time, breathe, enjoy nourishing food, and be well.
This looks great.
Yeah.